Once he started Diacommit, I'm like, oh, this is different. Something is different about my child.
Diacommit is an FDA-approved anti-seizure medication developed specifically to treat seizures associated with Dravet syndrome in children 6 months and older, weighing 15 pounds or more, and taking clobazam.
So Dominic had his first seizure when he was about 18 months old. It was a febrile seizure, so like most patients, he had a pretty severe fever. We took him to the hospital, didn't really know what was happening. Doctors played it off as nothing to be concerned about. Kids who have high fevers sometimes have seizures. I, of course, was not 100% comfortable with the situation, started doing research immediately on epilepsy, just to prepare ourselves in case he did receive that diagnosis. He was diagnosed with epilepsy at age 3, and then he was diagnosed with Dravet at age 5. It's exhausting because you're always looking for, am I missing something? Is there something I should be doing that I'm not doing? And especially with Dravet, when he was diagnosed, there wasn't a ton of information. There wasn't a ton of research that I could find. Dominic would always physically look like he needed to have a seizure. It's almost as if his face would darken and he just needed to release. And once he released and had a seizure, everything got back to normal, and then gradually it would kind of click back up again. Once he started Diacommit, I'm like, oh, this is different. Something is different about my child.
Diacommit is the first and only FDA-approved Dravet-specific anti-seizure medication for children as young as 6 months, weighing 15 pounds or more and taking clobazam.
We saw seizure control right away. He went 7 months and had a seizure, and then he's gone 6 years and hasn't had one.
The most common side effects are sleepiness, decreased appetite, agitation, impaired coordination, decreased weight, decreased muscle tone, nausea, tremor, slurred speech, and trouble speaking.
When we first got on it, it was just like, okay, here's another medication to try. He'd failed so many that we didn't have high hopes, but then once we saw that he actually went that full 6 or so months without having, before he had that breakout seizure, I mean, it was definitely relief that finally there was something that seemed like it was working.
Consistency, I think that's what you're missing often, just because it loosens us up a bit and helps us take a breath and step back and actually enjoy the process instead of being so overwhelmed or concerned about what may happen.
Control over my seizures. I've actually overcome those triggers. I work welding, which is a fire factory. The last year I was there, I was more of putting myself out there kind of person. Everyone having a good time. And then in the middle of a volleyball game, someone had a seizure in front of me. I sat with her, watched her, and that's when I realized that everything that I've been going through, with people watching me, I just did it myself.
He would always be the kid who would be right there if somebody had a seizure and be timing their seizure and telling the adults, here's what happened, I was right there, what can I do? So he's always been really empathetic with other kids and has such a great heart, and I'm extremely proud of that. That's given him a ton of independence and more than anything, control of his body, where he sometimes feels like he doesn't have a lot of control of his body. I think karate has shown him that he can calm down and have control.
He's tougher than most kids. that I see, just what he's able to deal with and what he's gone through and been able to still be, a kid, a normal kid, not let it affect him.
I hope that Dominic just lives a happy life. That is my one goal for him.
Indication: Diacomet, stiripentol, is indicated for the treatment of seizures associated with Dravet syndrome in patients taking clobazam and who are 6 months of age or older and weigh 15 pounds or more. There are no clinical data to support the use of Diacomet alone in Dravet syndrome. Warnings and precautions. Sleepiness. Diacomet can cause sleepiness. Your healthcare provider should monitor you for sleepiness, particularly when Diacomet is used with other depressants or clobazam. Decreased appetite and weight. Diacomet can cause a loss in appetite and weight. Your healthcare provider should monitor your growth and weight carefully. Changes in blood cell counts. Diacomet can cause significant declines in white blood cell and platelet counts, so your blood should be tested prior to starting treatment with Diacomet and then every 6 months. Withdrawal symptoms. As with most anti-epileptic drugs, Diacomet should be gradually withdrawn to lessen the risk of higher seizure frequency and status epilepticus, which is when a seizure lasts longer than 5 minutes or you are unable to fully recover from multiple seizures over 5 minutes or more. Risks in patients with phenylketonuria. Diacomet for oral suspension contains phenylalanine, which can be harmful if you have a condition called phenylketonuria. Talk to your healthcare provider about your total daily intake of phenylalanine from all sources, including Diacomet. Diacomet capsules do not contain phenylalanine. Suicidal behavior and ideation. Diacomet can increase the risk of suicidal thoughts or behavior. Your healthcare provider should monitor you for worsening depression, suicidal thoughts or behavior, and or any unusual changes in mood or behavior. Side effects. The most common side effects that occurred in at least 10% of patients treated with Diacomet in clinical studies, and more frequently than patients in the placebo group, were sleepiness, decreased appetite, agitation, lack of muscle coordination, decreased weight, decreased muscle tone, nausea, tremor, slurred speech, and trouble sleeping. Pregnancy. There is no adequate information about the risks of use of Diacomet in pregnant women. Based on information in animals, Diacomet may cause fetal harm. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to Diacomet during pregnancy. To enroll, you can call the toll-free number 1-888-233-2334. To report suspected adverse reactions, contact Biocodex at 1-866-330-3050 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information for Diacomet provided at www.diacomet.com.